Perfect. So here's an overview of our session today. As you can see, we're trying to fit a lot into the hour that we have together. And we want to make sure that we do finish a few minutes early because there is the Canadian Institute for Social Prescribing webinar that starts at 11 a.m. that I know many of you are also registered for. So with that, I'm going to pass it over to Karen McDonald to give a land acknowledgement and launch our newest core group.
Good morning, everybody. We have people joining from many regions. So I want to acknowledge that in our journey towards reconciliation, we honor the truth of our shared history and acknowledge the traditional territories of the people of Treaty 4, 6, 7, 8, and 10, regions of Alberta, and the Métis people of Alberta, regions 1 through 6. We also recognize the Inuit people who have made their home here. We're pleased to see so many people joining us here today to learn more about social prescribing work that is happening in Alberta. Healthy Aging Alberta is proud to be celebrating International Social Prescribing Day today with this panel discussion. Today, we're going to celebrate all the hard work that's happening in the communities across our province to grow our social prescribing network. Part of Healthy Aging Alberta's work is focused on facilitating collaborative action to support the integration of community-based services for seniors into the larger continuum of care, alongside systems such as health and housing. Social prescribing offers an exciting opportunity for us to do this. Social prescribing is gaining momentum right now in systems across Canada and beyond as a way of improving and coordinating service delivery. But as you hear more about the work happening here in Alberta, you're going to hear that the work of social prescribing is the work that many of you on this call have been doing for many years to deliver quality services to Albertans. It's an exciting opportunity with social prescribing to provide an opportunity to formalize much of the work that we're already doing by creating formal pathways between systems to clarify roles, to improve data collection and evaluation practices across organizations and systems so that we can build a case for support for future and additional investment in these critical services, and ultimately work more collaboratively in a more integrated fashion to deliver these same quality services to Albertans. So Healthy Aging Alberta and CORE are pleased to officially launch our newest CORE group on social prescribing today. This group will be a space where information and resources on social prescribing practice will be shared. The group will connect individuals already working on social prescribing initiatives in Alberta, as well as those who are interested in implementing a social prescribing model in their communities. Individuals will have the opportunity to foster discussion and share promising practices in alignment with Healthy Aging Alberta's provincial social prescribing model development. Please join the group by clicking on the link in the chat and take some time to introduce yourself and your interests in social prescribing. We're looking forward to growing this group and growing social prescribing initiatives for older adults in Alberta. I will pass it back to Beth to tell us more about the work that Healthy Aging Alberta is doing in this space. Beth?
Perfect. Thank you so much, Karen. So to start with, I wanted to give everyone an overview of what we mean when we say social prescribing. So social prescribing is a holistic, person-centered, and community-based approach to health and well-being that bridges the gap between clinical and non-clinical supports and services. It begins with an identifier, usually a clinical health professional, who identifies that a person has non-medical health-related social needs. The clinical health professional makes a social prescription, which is in essence a referral to what is called a link worker. The link worker is a non-clinical professional employed by a community-based senior serving organization, and they provide personalized support and focus on what matters to the individual. They co-produce a personalized action plan with the person, supporting them to assess their needs, strengths, and interests, and subsequently connect the person to the non-medical programs and services within the community by supporting them to access those resources and address any barriers that may exist. Our approach in Alberta is very similar to this diagram shown, other than that the link worker in our model is housed within the community. We just haven't had time yet to develop any fancy diagrams, but they are coming. So I wanted to give a little bit of a snapshot of what's happening right now in Alberta. We've been really fortunate to receive funding to implement a model in 6 communities over the next 3 years. I'm excited to share a little bit more about that work and what we have planned for the future. Right now, we're providing service delivery funding to 3 regional projects in Calgary, Edmonton, and Lethbridge. We'll hear a little bit more about the work happening in these communities shortly from our network coordinators. And later this year, we'll be introducing additional service delivery funding in 3 more communities. Right now, we're not sure which regions these projects will be in, but we'll likely look towards areas with high needs, existing partnership momentum, and a readiness to implement social prescribing. So some of the projects that we're funding right now have additional funding support from government partners. So each of these communities have between 2 and 4 link workers in place already. Each region has a network coordinator that's responsible for brokering relationships with partners in the health system and the community to grow social prescribing in their area. And being able to fund a portion of this role has been really helpful to ensure that this really important relationship brokering piece of the work is not just happening off the side of people's desks. Another unique part of our project is focusing on role clarity between positions in the community and the health system. We've been hearing that there's confusion about the role of the link worker versus the role of a social worker and other social services roles, both within the health system and the community. And so we have been able to add some social work capacity in those 3 regions to focus on the complex needs of clients, and so that the link worker role can be more relational, preventative, and refer into that social work capacity when appropriate. We're also excited to be working on developing a curriculum for that link worker role. Link workers currently don't need any formal qualifications to take on this work. It's much more important for them to understand the community resources that exist and have those soft skills needed to work with older adults. But we really want those individuals to have access to robust training that will support them in their work and really orientate them to social prescribing best practices that are emerging across Alberta and across the country. We hope that we'll have this published later this year, and that'll be a resource that can be shared with other organizations that are interested in creating link worker roles. So I'm excited to dive into our conversation today with our 3 network coordinators, and I'll introduce them. So Krista Mulberry recently joined the team at Edmonton Seniors Coordinating Council as the Social Prescribing Project Manager. Krista has been involved with seniors and recreation for over 15 years and is a dedicated advocate for seniors' health and wellness. Prior to starting as the Social Prescribing Project Manager in Edmonton, Krista was the Acting Executive Director and Program Manager at Elder Care Edmonton Day Programs. Krista has seen firsthand the benefits of social interaction, exercise, cognitive and leisure programs for seniors, and recognizes the vital impacts that community-based senior serving organizations and healthcare teams provide in strengthening wellness, independence, and overall health. Megan Hinks is a registered social worker in Alberta. She works for CARIA in Calgary as the coordinator for the Way In Network. She's worked with the network for the last 9 years with experience in frontline work such as outreach, worker, and supervisor, and recently moved into the coordination role for the Social Prescribing Project in Calgary. And then finally, Heather Bursaw is a registered social worker as well, with over 20 years of experience specializing in the delivery of psychosocial support to older adults. Heather has a Master of Social Work degree with a specialty in geriatrics and joined the team at Lethbridge Senior Citizens Organization after a lengthy career working with seniors within AHS. And Heather leads the development and delivery of the social prescribing program in Lethbridge, which launched in April 2020. And with that, I'm going to stop sharing my screen. And we'll get started with our panel discussion here. Perfect. Okay, I think we're ready to go. So I will start with the first question here, and we'll go to Megan first to provide the first answer to this. And our first question is just for our panelists to provide a brief snapshot of social prescribing in your community.
Sure. So here in Calgary, we have the Way In Network, which is a network of 4 agencies. This network has been around for over 10 years. The agencies that are included are Calgary Chinese Elderly Citizens Association, Calgary Seniors Resource Society, JFSC, which is formerly Jewish Family Service Calgary, and CARIA. This program provides networking, in-home supportive referrals, and case management services for older adults in Calgary. Building on this collaboration, since September 2020, the Way In Network has been working in joint collaboration with the agencies, primary care networks, and Alberta Health Services in the Calgary zone to focus on improving coordination of non-health related services that support healthy aging in the community and enhancing quality of life for seniors. Our program focuses on 55 plus age group. Those with limited natural supports require community-based supports, interaction with the health, they have to have interaction with the healthcare system in some manner for non-health related issues that can be supported in the community. Some of these things that we can assist with would be housing, so accessing safe and affordable housing, accessing financial benefits if they're having financial concerns, food security, isolation issues, navigating the mental health and addiction supports in the community, accessing transportation supports, reducing isolation by connecting those to social programming in the community. Our team works with the older adults in their own home or in a convenient community location.
Perfect. Thanks so much, Megan. And Krista, tell us a little bit more about the work that's happening in Edmonton.
Thanks for sharing that, Megan. It's great to always hear what's happening across different projects in Alberta. So our project here in Edmonton really began in 2019 with a group of collaborators from across the senior serving sector and from individuals in healthcare who really identified that need in our community for social prescribing for seniors 55 plus. So in late 2020, we were fortunate to receive funding from both the Government of Alberta, Ministry of Seniors and Housing, and through Healthy Aging Alberta to expand and extend upon our Aging and Community Supports program and to begin to develop that social prescribing pilot project here in Edmonton. The Social Prescribing Collaborative, including the Edmonton Seniors Coordinating Council, SAGE Seniors Association, the Jewish Family Services Edmonton, Multicultural Health Brokers, and Drive Happiness, aims to purposefully link healthcare systems with community-based senior serving organizations with an established formal referral pathway and mechanisms for ongoing collaboration and service delivery. Seniors can request a social prescription from their healthcare provider, or alternatively, healthcare providers, while working with their patients, might identify a need for social prescribing. So a healthcare provider can complete the Edmonton Social Prescribing 55 plus referral form and submit that to our central intake, which is located at SAGE Seniors Association. Some of those needs might include navigation of community services, assistance with applications for financial benefits, meal assistance or food security, housekeeping, grocery shopping, assisted transportation, socialization, housing, legal assistance, assistance with elder abuse, snow shoveling or yard maintenance, recreation and leisure, as well as case management. And so our central intake, what the central intake here in Edmonton does is they really connect seniors with that link worker role, who works with the client to identify their social needs, set goals, and work with the clients to really achieve those set goals. Link workers here in Edmonton are non-healthcare professionals who support clients to access community resources. The link workers here in Edmonton do not replace the role of a healthcare provider. Rather, they add an additional level of support for the clients. So through presentations, word of mouth, and healthcare provider frequently asked question form, we work to really create awareness surrounding the project with healthcare teams. And while we're in the beginning stages of the project, we have begun to receive referrals into the social prescribing project. We're working to develop communication tools for seniors on how to ask their healthcare professional for a social prescription, as well as a document for healthcare providers to provide to their patients on what happens after a referral is made. So as we move forward, we're excited to identify both the challenges and successes that we're having in supporting seniors to maintain their independence, health, and wellness.
Perfect. Thanks so much, Krista. And then finally, Heather, to explain a little bit more about what's happening in Lethbridge.
Sure. So in April 2020, LSCO, Lethbridge Senior Citizens Organization, started delivering supports to isolated and vulnerable seniors by offering information and referrals, short-term case management, and outreach support to seniors in need over the age of 60. The timing was ideal as it coincided with the pandemic, and levels of isolation and deterioration with seniors in our community were of concern, and many agencies were limited in terms of providing face-to-face services. In January of 2021, the Seniors Community Service Partnership, you'll hear me refer to it as the SCP, was formalized, which added multiple partners into the service delivery system. Those partners included Lethbridge Housing Authority, Norbridge Senior Centre, Canadian Mental Health Association, Volunteer Lethbridge, and Lethbridge Family Services. Senior Systems Navigators, so that's what our organization calls the link workers, also called SSN. I realized someone didn't want us to talk in acronyms, so I'll try to not do that. They were hired and housed in several locations around the city, primarily in senior centers and seniors housing buildings, where seniors could easily access support. Services were delivered in a coordinated fashion and centralized out of LSCO, where a team lead supervised the delivery of the program. Housing the navigators, the SSNs, on site with senior serving organizations where seniors were spending the majority of their time created opportunities for the team to build trust and encourage reliance on seniors' specific resources and supports available. The local housing authority had a built-in team who could support seniors who were experiencing housing concerns in terms of stability and any other age-related issues. And senior centers could be utilized to meet socialization needs as well as offer in-home support to assist seniors to remain in their homes independently for longer. The SCSP, so the entire partnership, is able to offer many of the services that Krista mentioned in terms of supporting people with forms, accessing resources, funding, housing, and then also able to access subsidized in-home support such as Meals on Wheels, housekeeping, lawn and snow care, lawn care and snow removal, weekly volunteer wellness calls, and free counseling, all of which are coordinated as part of the partnership and delivered through the SSN team. The main goal of the SCSP when we started creating the service delivery model was to establish community-based service delivery systems for people who are residing.
That's awesome. Thank you all so much for sharing that information. The next question that we have is, what is the impact you're already seeing or that you hope to see in the near future? I know some of the projects are at are at different stages, so looking forward to hearing about what everyone's seeing. And I think for this one, we'll start with Heather.
Sure. So since the inception of the partnership, or the SCSP, our team has strived to ensure that service delivery is coordinated. Systems are already complicated and difficult to manage. And although healthcare professionals and social service professionals work hard to ensure that service delivery is client-centered, sometimes the systems that we work within create challenges around that. The primary role of the navigation team is to navigate systems, advocate for clients' needs, and ensure that each individual achieves the goals that they set out. Feedback collected from seniors supported by our team confirm that seniors know where to come for support, trust the team members and guidance provided, and return for support as things change and as additional needs are identified. Feedback received from community professionals has been positive, especially from healthcare providers acknowledging the value of merging in-home community outreach resources with healthcare programs to reach beyond clinics and specific healthcare settings into the community and homes of seniors.
Awesome. Thanks, Heather. And Megan, I know Calgary is a little bit further along in their work. So what's the impact that you're already seeing or hoping to see in the future?
Sure. So since the start of the program, so September 2020, the intake system has received 545 referrals. And of those referrals, 464 are intakes into the program. So the discrepancy between the two is sometimes it's hard to get in touch with the client. The client has declined services since the referral has been made, or the client isn't an appropriate referral for our program and has been referred to a different service. The impacts that we have identified and that clients have identified is that there is an enhanced quality of life by connecting them to the benefits and income supports. Supported referrals to in-home supports. So that includes homemaking, snow mow, grocery shopping, friendly visits, essential transportation, like other programs in the province are providing. Stabilization of housing. So advocating with the landlord, finding support for damage deposits or rental arrears, supported referrals for connection to social programming in the community to build that natural support, supported referrals for mental health supports, and connection with their healthcare team to help support their health needs if that's also needed. When I say supported referrals, that means that they are working with either their outreach worker or their link worker, who will either do phone calls together, go to appointments together, just provide that connection piece. Some of the surveys and preliminary data that we have from surveys done with clients says that, and these are just numbers for you guys, but 83% report that the program supported them in accessing needed community services. 76 report that the program assisted them in communicating and advocating with their medical team. 78 report that the program assisted them in remaining independent in their community. And then these other numbers were self-reported because we don't have access to net care, but 86 have not been admitted to the hospital since participating in the program, and 81% report that they've not visited an emergency room since participating in the program.
Well, thanks so much, Megan. Those are really, really exciting stats, and hopefully over the course of our project here, we can see similar results. Krista.
Thanks. I would say definitely we have kind of that same real need for impact in the Edmonton project as some of that we're seeing in our other partnerships across the province. So the Edmonton project has been really well received so far from healthcare providers. They really recognize that the needs of people's health are needs that don't just happen within a healthcare setting. So that these needs might be best met with social connection, ability to financially support themselves, social supports, and so much more. So as we move forward in the project, we really hope to see that positive impact in connecting seniors to programs and services that really foster independence and engagement for seniors to improve that social inclusion, quality of life, and offer a proactive intervention to improving the healthy aging for older adults. We hope that the project really empowers people to take an active role in their health and well-being and really build that meaningful connection with community.
Awesome. Thanks so much, Krista. Next question's a little similar, but what is it that you hope that social prescribing will do for your community over the next 3 years? And so, Krista, I'll throw it back to you to start that one.
Yeah, and kind of to build upon that conversation in the last question, just really here in Edmonton, we're hoping to build out that network of social prescribing and in-home support partners and expand collaborative capacity to work together to support seniors, continuing to expand and implement referral mechanisms with home care case managers, Edmonton-based hospital transitions coordinators, primary care networks, and other healthcare providers. Again, really to address those non-medical needs outside of the physician's office to improve patient experience, cut wait times to see doctors, increase capacity for primary care, and just to alleviate that workload pressure that is existing on current staff. Again, focusing on those proactive interventions to improve and increase access to programs and services that really foster that independence and encouragement for seniors.
That's awesome. Thanks so much, Krista. And Heather.
Yeah, so my answer is very similar. I was going to say ditto, but I guess that's not allowed. Seniors residing in the community are expressing a desire to remain in their homes longer and actively seeking solutions in order to support them with that. Community and home-based resources are what people are saying that they want, and they're looking at how to get them in an affordable way, in an achievable way. So I would say it's our hope over the next 3 years that social prescribing will become common practice within the healthcare system and within other community resource or other community agencies. And seniors can expect that social solutions and community resources are offered along with a targeted outreach approach, along with the medical options and treatments that are offered in a clinical setting. So really hoping that when people are talking about age and the impact of age, that they can see that there's a medical component, but there's also that community component of how to build support networks and how to improve function in the community to achieve independence. So this will take collaboration between community-based organizations and the healthcare sector to share information and intentionally deliver services together.
Yeah, couldn't agree more. And then Megan.
I would also say ditto, Heather. But we're not allowed. So we hope here in Calgary that we can demonstrate to the health sector the value of in-home supports and non-medical supports and social prescribing through our shared measurement and collective impact. So demonstrating the cost savings to the health system with the reduced hospital admittance and ER visits. We hope for standardized elements such as an assessment, service planning, evaluation, but with a unique approach to each regional need, but that we're all collecting the same information so that we can all have the same voice and impact in the system. And also we hope that there would be sustainable investment for in-home support and social prescribing because we can prove that it works.
Yeah, it's so good to hear the three of you like speak about those things for your own communities and regions. I think that's exactly what we're trying to do on a provincial scale as well, right? Like, yes, we have these three projects happening in Calgary, Edmonton, and Lethbridge, but we really want to work towards investment in all communities across Alberta so that everyone can have these link worker roles, not just for older adults, but potentially for other populations as well. And I think there's so much potential, and I'm really excited to see how much things kind of grow and progress over the next 3 years as well. So it's good to see like almost 100 people here today that are also interested in that as well. So the next question that we have is, what's been the most challenging part of rolling out social prescribing in your community? And Megan, I'll get you to go first on that one.
Sure. So here in Calgary, some of the challenges that we found, because our intake, we're taking 55 and over, we found that there's this gap. So there's limited supports for 55 to 65, and accessing services that are available for this age group, whether it's housing or financial supports, they're limited. There's only a few options, or there's sometimes no options, or the client has exhausted all their options. Or the wait list is long, so it's supporting that client while they wait for the system to catch up to help support them to improve their life. Also expanding our knowledge base as a network to support those under 65 has taken time. We are established and know 65 plus like the back of our hand, but understanding those supports for under 65 and understanding that system has taken time. Also establishing referral pathways and building trust with those referrers has taken time and is a constant challenge. So we've had quick uptake with our PCN, so primary care network partners, but we found that it's taken more time to get refers from acute care sites. And we think that's just because of the pandemic and turnover and workforce challenges in the health sector. So we just find that we are constantly and committed to constantly having to provide the information for our program and reaching out to new social workers and new doctors and whoever else is new in those systems.
Perfect. Thanks so much, Megan. I think it's an important point that you mentioned about like some of the gaps that exist and how challenging it can be to navigate things like wait lists or if resources just don't exist. And I think that's another kind of part of our project is making sure that as part of our evaluation that we're kind of capturing where those gaps are as well, so that as we move forward, we're able to advocate for more investment in those spaces as well to make sure that there's shorter wait lists for different community programs and resources. And if there's communities where maybe programs and services don't currently exist, but there need to be, how do we kind of facilitate that from a community-based serving sector perspective as well? I think next we'll go to Krista.
Thanks. I think, yeah, we're seeing similar challenges as well, Megan, in looking at that. I think one of the other things that we're seeing too is just that currently many agencies are in a period of higher demand with a lot lower resources to support. Many community partners right now are under-resourced, and so this kind of presents that challenge of success in being able to navigate those community supports that are available for people. We know right now that with the current economic state, that there's a real need for access to food, for housing. And so those are also some of the challenges that we're seeing, higher gas prices, higher grocery prices, and these really impact, your quality of life, and especially for those who are on limited incomes. We're really focused and noticing that post-COVID realization that, what happens when you are alone or isolated for a long period of time. And so how do we help seniors coming out of that post-COVID realization and supporting that? And then in Edmonton, we've really been working to understand those resources that are available for ethnocultural supports. We know that a lot of times that creates a little bit of a barrier to access services. And how do we really work with those community resources that are involved with different ethnocultures to provide those supports to seniors, knowing that that might be a real specialized need?
Awesome. Thanks, Krista. And Heather.
Probably the biggest challenge in working and developing the system the way we're delivering it is funny because it's the name of our title. Our team title is actually navigating systems. So when you have a team of professionals and that's their job, knowing how complicated systems are and that they're changing, especially healthcare and healthcare systems, keeping ourselves informed and knowing about the systems and the system changes in a accurate or in a good time frame so that we can be informed while we are supporting seniors has been probably the biggest challenge. I think when you're not in them and you don't know how they work, it takes extra time to understand them and know how best to support people through them. So similar to how Megan mentioned, like establishing trust and being really proactive to reach out to build connections with service providers, new service providers, existing service providers who are in demand, like Krista mentioned. Everyone's working at over capacity for what they can handle. And so knowing that there are other resources that people can access, that's kind of where we're trying to work now, is understanding the systems for what they are, but also capitalizing on the supports that we can provide to offload some of that work. So investing in being proactive and exploring relationships and really strengthening those with the clinics and the other teams in the community that are trying to work through the same challenges that we are.
Yeah. Hey, I've got two more questions, and then we can get to some of the Q&As that are coming in through the chat. So the next question that we had planned here was, what is one thing that you want people, the attendees here today, to take away about social prescribing and the project that's happening in your community? So start with Heather for that one.
Sure. So from my perspective, social prescribing is truly meant to encourage the exploration of how the social determinants of health are impacting the aging community. So while healthcare challenges are a reality for all of us as we age, considering issues such as housing stability, financial access, social and community connections, and how they impact a senior's functioning and quality of life is important. Listening to seniors and asking what matters to you within the context of their life and where they're at is the best way for the social service sector and the healthcare system to merge purposes and positively impact that aging community. I think that making sure that keeping in mind that really what it is, what matters to the person that you're supporting and how that can be delivered collaboratively is really the most important part of considering the social pieces and the medical pieces together and how those can be supported together.
Yeah, that's great. Thank you so much, Heather. Megan?
Sure. So for us here, I think the journey for social prescribing in Alberta is new and exciting, and has been intertwined with the work in enhancing non-medical in-home supports across the province. And I think for us, if you can take one thing away, I think that there is the potential for huge impact on the future of community care for older adults in Alberta and across Canada.
Perfect. And Krista.
Well, I think social prescribing really has the ability to connect healthcare to community, community to community, people to community, and people to people. So in the Edmonton context, this really bridges healthcare providers to community organizations, strengthens and builds community connections between those community-based senior serving organizations, connecting seniors to the resources that are available to them, as well as connecting seniors to one another. And I think those are really the important foundations that I would say that we would take away from social prescribing, is how do we connect healthcare to community, community to community, community to seniors, and seniors to one another.
Perfect. And then the last question that I have here, and I'm hoping this will be a really engaging one for some of our attendees, but what advice do you have for communities who are interested in developing their own social prescribing programs in the near future?
And I think that one's jumping over to me. So I would recommend by kind of first establishing where you see that need for social prescribing in your community, and then taking a look to assemble a core team to develop that working plan and map out those resources that might be available in your community. I also invite communities to kind of check out the World Health Organization toolkit on how to implement social prescribing, and encourage them to connect with myself, Megan, Heather, or Beth for more information. I also, there is the Canadian Institute for Social Prescribing to learn more about the initiatives that are happening underway across the country. So lots of opportunity to kind of reach out to those around you who have those initiatives and have started to kind of build those pathways, but really taking a look at your community and where those needs might be best met.
Awesome. Thanks so much, Krista. Heather, any thoughts on that?
Yeah, so my advice is to consider who's already committed to delivering services for seniors in your community. Approach them, discuss what each of them can bring to the table in terms of knowledge, resources, and skills, and establish a partnership that will allow you to collectively leverage what your agencies already have. Once you have a solid understanding of what impact you can make, start offering that together. Build relationships, create referral pathways, consult files, use each other's strengths while you create a system. Once you get into the groove, start engaging healthcare professionals and programs, reach out to doctors' clinics, and show them the impact that you can make.
Yeah, that's really great. And then finally, Megan.
I think we all have the same advice, is to start building the relationships with the community who's already providing those services, connecting with the health sector, establishing those referral pathways, whether it's with your primary care network, with acute care, with community health programs. And here in Calgary, before this program, we had a case collaborative, which was with service providers in the community, and they would come together and discuss a case anonymously and problem solve together. So we as a network could show our the caliber of work that we could bring to the table, which helped build the trust with those referring partners, so that when we brought this new social prescribing program, there was already that trust built. I would encourage people to just get started, build and learn as you go, and utilize the services and resources that are already available, whether it's connecting with the four of us, or using the information that's available through the national website or the World Health Organization. Be committed, and this work takes time, but it is so beneficial to our community and our province.
Thanks, Megan. I think it's important that we all have kind of that same perspective on what's so important for communities that are interested in this work, because the relationships are such a big part of it. And I think the projects in these three regions have been so successful because there have been champions that are kind of passionate about social prescribing, see the vision, and are kind of committed to seeing it through. And so it's another piece of, I guess, advice that I would recommend for people is to identify who those champions are in your communities, connect those with us as well. I think Healthy Aging Alberta is here to kind of support the development of social prescribing in more communities in Alberta. And so whatever resources that we can share, whatever help that we can provide to kind of spur this on, we're happy to do so. So please, 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 please connect with us if you're interested in making this a reality in your community over the next little while. And with that, I think we're switching to some participant Q&A. So I do have a few questions that have come in that I've taken from the chat box. So please feel free to keep sharing questions. We'll get to as many as we can. The first question here is more so around evaluation. So does the project provide funding for, and will the team be undertaking research to evaluate the impact on health system utilization, i.e. positive hope for impact on reducing hospitalizations, emergency department use, etc. So I don't know if anyone wants to take that on.
Well, I think, yeah, so we definitely do have some evaluation that we are going to be putting together as a coordinated group throughout these 3 projects, as well as those additional projects that are going to be adding into that larger provincial scope. And so, yes, taking a look at, what those hospitalizations, how are we reducing the acute care hospitalizations, ER admissions, as well as primary care capacity. I think those are really important things that we'll be looking at in this. And so yes, I definitely think that both at a local level, we are looking at those things, as well as at a collaborative provincial level too.
Perfect. Thanks, Krista. Megan or Heather, I'm not sure if you have anything to add or if we move on to the next question. No, perfect. The next question here, and someone did already respond to this a little bit in the chat, but how can health and primary care teams support and help sustain this work? And how far reaching is this outside of these 3 main cities right now?
I can just speak for the southern area of the province. With our team having been formally established in January of 2021, and my recommendation of kind of work with it, figure it out, get into your groove. The program's been running for 2 years, and it's well known. People make referrals, professionals make referrals, people seek it out themselves. And there are clinics, primary care clinics that we do already have relationships with, just from driven success in referrals in the past. So we have some that already provide a lot of referrals and we can work collaboratively with. And so for us, it's working and strategically targeting some of the other clinics who don't know about us. And that's just kind of boiled down to time and resources as to investing in that, but also knowing that provincially we're trying to have bigger messaging that's targeting everybody kind of at the same time, so that if you're in this primary clinic or this primary care clinic or that one, it's something that's being targeted across the province. So we're currently just in the city of Lethbridge, but again, with capacity to add other communities, we're supportive of whatever community that might be that wants to join in.
Perfect. Krista?
I think another area where primary care health teams can really help support that is by seeing those proactive approaches when they're working with their patients and referring them into community-based services. Without referrals, we don't have social prescribing. And so doing those actual referrals into the community to really help build that need for those to happen, as well as to help us on the evaluation front. What are the successes that you're seeing in your team as a result of the social prescribing that's happening within your area?
Yeah, that's awesome. Megan, anything else to add?
Not really. I think I was on the same wavelength as Krista, like just making those referrals, because we do have our formalized intake system already, and professionals are referring. So also spreading the word. So if you've had success with this program, spreading it to your other coworkers or other professionals that you know of who might not know about our programs.
Yeah. The other thing that I will add to that, I think we've got some really great healthcare provider champions throughout the province that are big advocates for social prescribing in this work. And I think we need to create more of those champions and kind of equip them with the messaging and the tools that they need to kind of continue to advocate for the value of the community-based services that clients are being referred into. I think oftentimes we see the health system trying to fill all of the roles that patients might need, and community is here, and we're excited to be providing the programs and services for older adults. And so if we can have people within the healthcare system also advocating for that and the role of community and providing those services, I think that will go a long way in making sure that we're able to sustain this work and receive the investment that we need to make this kind of flourish within our communities. Okay, let's see here. So this question, when first starting a social prescribing program in your community, what is the best way to engage with healthcare providers who would be making the referrals and get them on board? Anyone want to start that one? I know that's a lot of the work that's happening right now, in engagement with different healthcare providers and PCNs and clinics. So, Krista?
I think having those tools necessary and readily available for healthcare providers, we know that healthcare providers are extremely busy in the work that they're doing. And so having tools that are quick, easy to digest and understand is really important, so that, you know, it can be a quick glance to see what's happening within your area, as well as really just starting to build those connections. Maybe it's going out to do presentations with, you know, targeted groups, depending on what those client needs that they're seeing, because we know that a team in recreation need is going to look a little bit different than a team in occupational therapy. And so how do you target that messaging in terms of who you're trying to talk to and to share that information with, of how it would best support the work that they're doing and the patients that they are seeing.
Yeah, that's a really good point. Heather, did you have something to add to that?
Yeah, I was just going to add, a success for me has been being responsive. So when a clinician does make a referral or make a phone call of like, I don't know if this is something you guys can help with, being there for them quickly, because I know the turnover is quite quick and the pace is quick in their offices. Even if it's just consultation of, they're stuck with somebody, they're wondering what to do. And so providing an answer that they can run with, or saying like, hey, we can actually come over there and meet with them with you next time they're in the clinic. Or so that's what they reported to me, was the fact that you always pick up the phone, you always make time to have the conversation. We know we can trust that you're going to deliver what it is you're saying you're going to deliver.
That's a really good point. Megan, anything else to add?
Not really. I think they covered it. Like, just being prepared with your message, your program, and yeah, being available to answer those questions. And yeah.
Awesome. There was a question asking if there is a social prescribing form for Calgary, and I know that there is already a referral form that the Way In Network uses. So if you're interested in receiving that form, I think Megan would be able to provide that to you. So maybe just put your email address in the chat box, and we can make sure that you receive that social prescribing form for Calgary. And same thing, if you're interested in seeing it for Edmonton or Lethbridge, we can make sure that you get that resource as well. Okay, maybe we'll have time for one or two more questions. The question I have here is, what are the top types of non-medical support you see intakes need in?
I can jump in and say at this point, it's affordable housing. That's the biggest thing that we're getting asked to support people with. Finding subsidies, finding accessible housing that's affordable is extremely difficult.
I would say for us here in Calgary, that's a big referral that we receive, is for housing and doing the applications for the subsidized housing. And also finding financial support. So whether that's doing the applications for Alberta Seniors Benefit or for CPP or for Alberta Works, getting access to some financial supports for those individuals.
And I think here in Edmonton is the same, are those two that we're really seeing is that top or that financial need for applications for, especially with the ever changing, benefits that are available to people from both a federal and provincial level. So kind of navigating what's out there and available to people and that need for affordable housing.
Awesome. Let's see, I've got one more question, time for one more question here. Have you had any experiencing in social prescribing in various continuing care sites?
I can just speak to our community. The program that we've developed supports people until they enter into supported living level 3. We do assist people in lodges, apartments, but if it kind of moves into the coordinated access center type housing options, we don't support that area.
Yeah, I will add to that and say, I think provincially as well, like social prescribing in our model is really meant to be a community-based program and more preventative in nature for people that are still living within their own homes and are needing support accessing those social determinant of health needs before they're entering into higher levels of care. So awesome. I think that's it for our questions. I think we got to all the questions that were asked in the chat box. So I really appreciate people taking the time to share their thoughts and their questions. If you're interested in joining the core group on social prescribing, please do so. The link will be shared in the recording and the email after the webinar. And that will be a great space as well to answer questions, share resources, and other things like that. So I will end here. Thank you all so much for joining today. Please check out CORE Alberta. We will also be sharing a survey. This is really important to make sure that we're capturing the information that you want to hear, and so that we can improve for events in the future. So please complete the survey that you'll receive in your email, and giving everyone 5 minutes to hopefully join the national webinar that's starting right after this. So thank you all so much.
There's just a question, Beth, about getting on the national webinar.
The link for the national webinar would have been a different link, but let me see if I can find it for those people that maybe didn't have it. If they're still on the call, because it would have been a different link. Let me see.
Hey Beth, I was just trying to get on it, but it says registration is closed, so you can't join.
Okay, let me see if I can copy this link and it should work for folks. People are still here.
I'm sure they'd rather have more people rather than less.
Yes, try clicking on that link. It was the one that was in my email, so hopefully it will work for others as well.
Okay, I had joined it, but then I had to drive somewhere, so I was trying to rejoin. Okay, so click on the link.
Try clicking on that link that I shared in the chat, and it should take you to the national webinar one.
Okay, all right, thank you.
Awesome. I'm going to end this meeting because I have to jump into that next one as well. But thank you all again, and we'll be in touch. Okay, thank you. Bye.
Bye.